with musculocutaneous nerve পেয়ে গেলে, two roots of median nerve and the median nerve itself. Then if you leave the space between the two blood vessels, that is axillary artery and axillary vein, you will find two thin branches. There is the medial cutaneous nerve of arm and forearm. They are in between the artery and vein. All right. Then if you lift up this blood vessels, এরকম করে lift করলে দেখবে নিচে ulnar nerve আসছে, and more deeply you will find radial nerve in this direction. Radial nerve টা এরকম করে আসছে, ঠিক আছে, towards the groove. Radial nerve টা এরকম করে আসছে, ঠিক আছে। তোমরা if you explore the posterior wall of the axilla, all right, you will find on the subscapularis muscle the radial nerve is descending down. On the subscapularis muscle the radial nerve is descending down, and you will find axillary nerve. There are three branches. At this point you can see three branches. Number one, upper subscapular nerve, lower subscapular nerve, and the thoracodorsal nerve. And from the lateral cord, you will find, if you trace the lateral cord, you will find the axillary nerve around the neck of the humerus. All right. So, upper subscapular nerve supplies which muscle? Supply of upper subscapular, lower subscapular, and thoracodorsal. Upper subscapular muscle কাকে সাপ্লাই করে? It supplies the upper part of subscapularis muscle. All right. The lower subscapular muscle supplies the teres major. Lower subscapular nerve supplies the teres major, and the thoracodorsal nerve supplies the latissimus dorsi. All right. That is in the floor of the bicipital groove. All right. Why I haven't drawn, this is teres major. I haven't drawn the teres minor because teres major is in the front plane. From the scapular lateral border, it is coming to the frontal plane. All right. On the medial aspect of the medial border of the bicipital groove. This is teres major, this is pectoralis major, and in the floor that is latissimus dorsi. ठीक है? So this is from the back to the frontal plane, and the teres minor will go behind. From this, it will go in the back plane and will be inserted in here. There are three impressions on the back of the greater tuberosity. Greater tuberosity lateral aspect, posterolateral aspect, তিনটি impression আছে, ঠিক আছে। Upper one is for supraspinatus, middle one for the infraspinatus, and lower one is for the teres minor. ঠিক আছে? এর কোথা দিয়ে দেখতে পাবে? From the back. All right. So that's why I haven't drawn the teres minor in the frontal plane completely. এটা আমি পুরোটা আঁকিনি, ঠিক আছে। এইখানে bicipital groove থাকবে, এইখানে bicipital groove থাকবে, ঠিক আছে। teres major is going to attach to the floor, and here will be pectoralis. In the lateral lip there will be pectoralis major. In the medial lip there will be teres major, and in the floor there will be latissimus dorsi. Right? Now how to find the axillary nerve? Axillary nerve কি করে খুঁজে বের করব? ঠিক আছে। এই ডিসেকশনে In this dissection, you will not be able to find the axillary nerve. Axillary nerve টা খুঁজে পাবে না। Radial nerve দেখতে পাচ্ছ, ঠিক আছে? কিন্তু lateral cord টা পাবে না। From where you can find the axillary nerve, এটা পাবে না। Then you have to explore the scapular area. Then you have to explore the scapular area. upper part, this one is the levator scapulae, ঠিক আছে? এই স্কেচ পেনগুলো স্লিপ করে যাচ্ছে, ঠিক আছে, লেখা যাচ্ছে না। This one is levator scapulae. Next is the rhomboideus minor, this rhomboideus major, and this is latissimus dorsi. This is teres major, and this one is teres minor. All right, this is the long head of triceps. This is medial head of triceps. This is lateral head of triceps. In between these two, there is the radial groove on the posterior aspect of the humerus. All right, the upper part is the lateral head of triceps. The lower part is the medial head of triceps. And from the infraglenoid tubercle, this long, thin muscle is the long head of triceps. All right, in between the lateral head and medial head, we see the radial nerve as well as the arteria profunda brachii is coming out from in the radial groove. ঠিক আছে, সবগুলো দেখতে পেলাম। তার সঙ্গে আমি axillary nerve, this is the upper quadrangular space, this is the lower quadrangular space. So upper quadrangular space, there is the axillary nerve coming out around the neck of the humerus and giving rise to two branches, anterior division and posterior division. Anterior division is coming out and supplying the anterior fibers of deltoid. Posterior division is coming out, giving a branch to the teres minor, and there is a pseudoganglion. So posterior division of axillary nerve supplies the teres minor. এটা পরীক্ষার সময় জিজ্ঞেস করবে, ঠিক আছে? This will be asked in the examination. Where is the posterior division of axillary nerve? The anterior division of axillary nerve is winding down the neck of the humerus along with the posterior circumflex humeral artery. ঠিক আছে, এই সঙ্গে যে লালটা আঁকা আছে, this one is the posterior circumflex humeral artery. So this is the green দিয়ে আঁকতে পারলে হতো, গ্রিনটা ভালো কাজ করছে না। To the upper quadrangular space, this is anterior division, this is posterior division, there is a pseudoganglion, and these are the branches supplying the deltoid. I have asked one question, that why military badges are worn at the lower end of the deltoid muscle. Deltoid muscle এর কেন নিচের পার্টটায় মিলিটারি ব্যাজ পরানো হয়? ঠিক আছে, so these fibers are going to supply the anterior part of the deltoid. These fibers are going to supply the from anterior division These fibers are going to supply the anterior division of deltoid, and from the posterior division they are supplying the posterior part of the deltoid. ठीक है? And through the lower quadrangular space we can see the radial nerve and the arteria profunda brachii is coming out. ঠিক আছে? এটা দেখে তোমরা বাউন্ডারিটা বলতে পারবে তো? আপার কোয়াড্রাঙ্গুলার, লোয়ার কোয়াড্রাঙ্গুলার অ্যান্ড ট্রায়াঙ্গুলার স্পেস বলতে পারবে তো বাউন্ডারিটা? একজন কেউ বলো। আপার কোয়াড্রাঙ্গুলার ট্রায়াঙ্গুলার স্পেস এইটা, বিটুইন দ্য টিরিস মেজর, টিরিস মাইনর অ্যান্ড দ্য লং হেড অফ ট্রাইসেপস, এই জায়গাটা হচ্ছে triangular space. Then quadrangular space is this one, that is the teres minor above, teres major below. Medially is the long head of triceps, laterally is the surgical neck of shaft of the humerus. ठीक है? Upper third of shaft of humerus. This is the upper quadrangular space. Lower quadrangular space, in the lower quadrangular space we find teres major above, laterally is the shaft of the humerus, and medially is the long head of triceps. Boundary গুলো একবার দেখে নাও, what are the boundaries? Through this dissection you can find the axillary nerve as well as its branches. ঠিক আছে? Now tell me, what are the forearm muscles? Now we have got medial nerve. Medial nerve is coming in between two heads of pronator teres and entering into the forearm, and in between the superficial and deep muscles of the forearm muscle. What are the superficial muscles and what are the deep muscles of forearm? Medial epicondyle is the flexor epicondyle. Lateral epicondyle is the extensor epicondyle. So this is your forearm, like this. There will be 5 muscles like this. All right. The upper one is the pronator teres. Then this one is the flexor carpi radialis. This one is the palmaris longus, and this one is the flexor digitorum superficialis. Right. There will be these 5 muscles, and below this there will be flexor digitorum profundus, flexor pollicis longus, and flexor carpi ulnaris. These are the deep muscle. এখানে কটা বললাম আমি? pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and flexor carpi ulnaris. These are superficial muscles. And deep muscles are flexor pollicis longus, flexor digitorum profundus, and শুনতে পাচ্ছি না, pronator quadratus. All right. So these are the deep muscles, and in between this plane median nerve is coming out. ঠিক আছে? median nerve কে এখানে wrist-এর কাছে, median nerve can be seen more easily near the wrist joint. কি করে বের করবে? কোথায় আছে? where it is? median nerve wrist joint-এর কাছে আছে. ঠিক আছে? কি করে বের করবে? এই যে টেন্ডনটা দেখতে পাচ্ছ? ঠিক আছে? ক্যান ইউ সি দিস টেন্ডন? এই টেন্ডনটা দেখতে পাচ্ছ? দেখতে পাচ্ছ এই টেন্ডনটা? ঠিক আছে? আরও প্রমিনেন্ট করে দেওয়া যাবে। এই যে প্রমিনেন্ট, এই টেন্ডনটা, এই টেন্ডনটা কার টেন্ডন? হুজ টেন্ডন ইজ দিস? কোন মাসেলের টেন্ডন এটা? Flexor carpi radialis. Thank you. Nice. Very nice. So this is flexor carpi radialis. Just lateral to it, in between the flexor carpi radialis and the palmaris longus, you will find the median nerve, slightly in a deeper plane than the flexor carpi radialis. All right. Now, how to find the ulnar nerve? Ulnar nerve is just below the flexor carpi ulnaris. All right, together with the ulnar artery, ulnar nerve, flexor carpi ulnaris এর তলা দিয়ে যাচ্ছে। ঠিক আছে? Now come to the extensor muscles. Come to the The lateral boundary of the flexor compartment. What is the lateral boundary of flexor compartment? How the flexor compartment is formed? Between the medial and lateral intermuscular septum. Alright. But at the lateral intermuscular septum is interrupted by two muscles. Most prominently the brachioradialis. তুমি যখন flexor group of muscles কে explore করছো, ঠিক আছে? Your job is to find the lateral limit, that is the brachioradialis. You have to find the brachioradialis, alright? And more laterally is the extensor carpi radialis longus. More laterally is the extensor carpi. When you find these two muscles laterally, then you know, yes, this much is flexor compartment. If you go beyond, you will be confused. You will be, ঠিক আছে? Your organization of the muscle tendons will be wrong because you are not separating the brachioradialis and the flexor carpi radialis flexor na extensor carpi radialis longus. All right, this overlaps the flexor compartment, right? And deep to the brachioradialis there is lower lateral cutaneous nerve of radial nerve. Lower lateral cutaneous nerve of radial nerve. ঠিক আছে? This is a subcutaneous. It comes down deep to the brachioradialis. Right? Now tell me the muscles of extensor compartment. Extensor compartment e ki muscle ache? Flexor na. Extensor carpi radialis longus and extensor carpi radialis brevis together with brachioradialis. Three muscles. All right. Then you have to tell in a manner that in the extensor compartment, that is in the back of the forearm, we have 12 muscles. Alright. In the superficial group, there are 3 plus 4. 3 is lateral and 4 is posterior. And in the deep group, there are 5 muscles. Alright. So, what are the 3 muscles lateral on the superficial group? Laterally is the brachioradialis, extensor carpi radialis longus and brevis. Right. Now in the posterior group, yes, Anconius is there, extensor digiti minimi, extensor digitorum. Very good. Nice. Alright. Now so lateral and posterior group is done. Now the deep group. Tell me the deep group. Abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus and extensor indicis and supinator. Right? So, how to split, how to find out the posterior interosseous nerve of branch of the radial nerve. এবার radial nerve posterior interosseous branchটা তুমি কি করে বের করবে? How to find it out? এই যে এখানে ব্যাকে, ঠিক আছে, তোমাকে কি করতে, what you have to do, you have to keep the extensor carpi radialis longus and brevis. This is lateral. Alright. All other muscles medially, and you split it. You split it. You will find the extensor digitorum. Deep to it is the extensor indicis. Alright. You keep these muscles on the lateral aspect, and there will be a muscle cleavage. There will be a muscle cleavage, and at the lower end you will find abductor pollicis longus and extensor pollicis brevis. These are coming deep to the extensor carpi radialis longus and extensor carpi radialis brevis. ঠিক আছে, এই দুটো মাসেলের নিচ দিয়ে এরকম করে দুটো টেন্ডার এরকম করে বেরিয়ে আসে। অলরাইট। অ্যান্ড এক্সটেনসর ইন্ডিসিস ইজ কামিং এ লিটল অ্যাবাভ। তাহলে তিনটে, ঠিক আছে, এক্সটেনসর ইন্ডিসিসের তলায় আরেকটা মাসেল আসছে, দ্যাট ইজ দ্য এক্সটেনসর পলিসিস লঙ্গাস। ঠিক আছে, দিস থ্রি উইল ইউনাইট অ্যাট দি থাম্ব। ঠিক আছে, তাহলে ওটা বের করতে হলে আমাকে কী করতে হবে? ফার্স্ট আই নিড টু সেপারেট দ্য এক্সটেনসর কার্পাই রেডিয়ালিস লঙ্গাস অ্যান্ড brevis. Then I will find the extensor digitorum, extensor indicis deep to the digitorum, then the extensor digiti minimi and the extensor carpi ulnari. They will be on the other plane. In between these two planes, you will find the supinator, which is in between the deep strata and the superficial strata. The posterior interosseous nerve is coming out. ঠিক আছে, সুপাইনেটারটা বের করলে, এই দুটোকে স্প্লিট করলে, দুটো মাসল গ্রুপকে স্প্লিট করলে, then you find the supinator muscle, and you will find in between the superficial and deep strata the posterior interosseous nerve is coming out. All the extensor muscles except the brachioradialis, anconeus and extensor carpi radialis brevis, except these three muscles, all the extensor muscles in the posterior compartment of the forearm are supplied by the posterior interosseous nerve. All right, সব কটা মাসল posterior interosseous nerve supply করে except the brachioradialis, extensor carpi radialis longus and the anconeus. ঠিক আছে, compartment wise I have shown the branches of the radial nerve and ulnar nerve, right? This is recurrent median nerve branch. This is two proper digital branch of median nerve. This is one proper digital nerve of the median nerve. These two are the common digital nerves for these two fingers. This is lateral division, this is medial division. And for these two fingers, there is the ring finger and the little finger. One is the common digital nerve and one is the proper digital nerve for the medial side of the little finger. I have drawn, আমি তোমাদের দেখিয়েছি একে, ঠিক আছে? So from ulnar nerve we get the first and second supply to the third and fourth lumbricals, and for the first and second lumbricals these branches come from the median nerve. ঠিক আছে, median nerve থেকে আসে first and second lumbricals এর supply, and from the ulnar nerve comes for the third and fourth lumbricals, and all the other short muscles in hand are supplied by ulnar nerve. All these are supplied by ulnar nerve. The superficial branch of the radial nerve winds round about 7 cm above the lateral border of the forearm. This winds round and goes to supply the superficial cutaneous structure of the hand. ঠিক আছে, এটা এখান দিয়ে এরকম করে চলে যায় from under cover of the brachioradialis muscle. সেখান থেকে এটা পিয়ার্স করে এটা সুপারফিশিয়াল ব্রাঞ্চটা এখানে চলে আসে। ঠিক আছে, বোঝা গেল? সবকটা নার্ভ তুমি দেখতে পাচ্ছ কিনা, কোনটা কোথায় আছে তুমি দেখতে পাচ্ছ কিনা, দ্যাট ইজ ইম্পর্টেন্ট। হুইচ নার্ভ ইজ ওয়্যার, তুমি দেখতে পাচ্ছ কিনা, দেন তারপরে তো তুমি অ্যানাটমি লিখবে কোনটা কী কোত্থেকে কী হয়। ঠিক আছে, the course of the radial nerve along with its branches on the posterior aspect of the humerus, on the posterior aspect of the humerus. Now you know where is teres minor, where is teres major, right? Where is latissimus dorsi, where is levator scapulae, where is rhomboideus. Now one thing, that is the long thoracic nerve of Bell that comes from the roots of the brachial plexus. C5, C6 and 7 root gives rise to they unite and forms the long thoracic nerve of Bell. From the root comes the thoracodorsal nerve, a tweak to join the phrenic nerve, long thoracic nerve of Bell, and the nerve with C5 root that supplies the longus colli and scalene. These are from the roots of the brachial plexus. And from the trunk there is another two nerves, that is suprascapular nerve and nerve to subclavius. All right. Now this long thoracic nerve of Bell, yesterday I have drawn it. All right. This long thoracic nerve of Bell, remember when you dissect the thorax, to find the long thoracic nerve you have to go beyond the mid axillary line. Mid axillary line cross করে ওপাশটা যখন তুমি স্কিন আর সুপারফিশিয়াল ফাসা তুমি সরাবে, then you will find the segments of the serratus anterior. There is a peculiarity in the muscle and long thoracic nerve supplies segmentally. ঠিক আছে, মানে মাসল ফাইবার্সের বাল্কটাকে ও পিয়ার্স করে সাপ্লাই করে দেয় না। ঠিক আছে, যেমন করে there are intercostal muscles in between two ribs, so they are segmented, right? Long thoracic nerve of bell also supplies the serratus anterior segmentally, right? Upper 8 ribs beyond the anterior part of intercostal cartilage. Beyond this cartilage, the ribs give origin to the serratus anterior. Act 1 to 8 rib. ঠিক আছে? This muscle bellies goes, remember, এইটা তোমার scapula, this is scapula, this is the vertebral border, this is the lateral border, and this is thorax. From here, segmentally, the serratus anterior muscle is coming. Remember, এই serratus anterior muscleটা এরম করে, এটা scapula রয়েছে, this is subscapularis muscle. This is finding the vertebral border even deep to the subscapular muscle. ঠিক আছে, subscapular muscle-এরও ডিপ দিয়ে এই মাসল ফাইবারসগুলো গিয়ে ভার্টিব্রাল বর্ডারে গিয়ে অ্যাটাচমেন্ট নিচ্ছে। ঠিক আছে, ভার্টিব্রাল বর্ডারে গিয়ে অ্যাটাচমেন্ট নিচ্ছে। অ্যান্ড অন দ্য dorsal aspect, in the vertebral border, we find levator scapulae, rhomboideus minor and major, rhomboideus minor and major, latissimus dorsi, and the rhomboids are antagonistic muscle. When we climb the tree, this group of muscles are alternating. Contraction, relaxation is alternating. And when there is injury to the long thoracic nerve of bell, all right, there will be unopposed action of the rhomboid, and there will be winging of scapula. There will be winging of scapula. ঠিক আছে, এটুকু থাক, then I will continue. ঠিক আছে, find the nerve, read the anatomy, find other associated structure, and find the nerve where it is. ঠিক আছে।